Welcome everyone to the 2019 open enrollment for Legence Bank. Legence Bank partners with Assured Partners. We are here in the Bowling Green office to assist you with any claim issues that you may have. If you have a service issue, if you need an ID card, remember that we're just a phone call away, so we'll be more than happy to assist you with any of your benefit needs. Please note that the following slides were designed to provide you with a brief overview of your 2019 benefit package. In the event of a conflict between the carrier, the summary, and this plan description, the terms of the carrier summary will prevail. In this presentation, we will review the following: benefit basics, medical benefits, wellness, value-added services, HSA bank account, dental and vision benefits, life and disability benefits, as well as accident, cancer, and critical illness. Please note that this is your 2019 open enrollment. All benefits that you elect for 2019 effective 11/1 will remain in place until the next annual open enrollment, this time in 2020. Anytime that you can make a plan change outside of open enrollment will be with a qualifying life event. And a qualifying life event would be birth, adoption, legal guardianship, divorce, legal separation, marriage, death of policyholder, turning age 65 and aging off a parent's plan, loss of Medicaid, FMLA-related leave, loss of employer-sponsored group coverage. You have 30 days from the event date to ensure that there's no disruption of coverage. You will need to notify the Human Resource Department of any plan changes within that time frame. Other than that, the next time that you can change any benefits will be again this time in 2020. Medical benefits will remain with Blue Cross Blue Shield of Illinois. You have 4 options in which to choose from. As you can see by the grid, the first 3 columns indicate HDHP. That's a high deductible health plan. It's also HSA bank compliant. These 3 columns are what I want to focus on first, the high deductible health plan. With a high deductible health plan, you must first meet your deductible before any benefits are paid. There are no copays associated with these plans. Option 1 is called a low plan. It has a $2,500 calendar year deductible. The mid plan is a $2,800 calendar year deductible. And the third column indicates a high option. It's a $1,500 calendar year deductible. If you're enrolling for single coverage, that first column, the $2,500, $2,800, $1,500 are the columns that you need to focus on. The second behind the slash mark is a family deductible. We'll get into that in the next few minutes. The difference in these plans with the low plan, once you satisfy your deductible, the carrier will pay at 80%. Your responsibility will be 20% until you hit your out-of-pocket limit of $5,000. Once you hit $5,000, then the carrier will pay all covered services at 100% for the remainder of that calendar year. The mid option is a $2,800 single deductible. Once you hit your deductible, then everything's paid at 100% until you hit your out-of-pocket of $2,800, which is the same as your deductible. It's all one bucket, and then the carrier will pick up at 100% for the remainder of that calendar year. So that's your total exposure, $2,800. The third column, the high option, indicates a $1,500 single deductible. The coinsurance split is 80% for the carrier, 20% for you, until you reach $3,000 out-of-pocket limit. And again, the carrier will pick up on all covered services for the remainder of that calendar year at 100%. It all resets January the 1st. Now, for those of you who are enrolled in a plan now, your deductible and out-of-pocket will carry over 11/1 into the plan that you elect for 11/1. And then again, it will reset January the 1st because it is a calendar year basis. So with these plans, as you can see, when you go to a primary care specialist or you go to an emergency room care, if you go get prescription drugs, everything is subject to your deductible. Now it is HSA compliant, so we'll start reviewing the HSA bank information on a future slide. One thing I want to point out on these benefits is that the first plan, as you can see in the column there, we've named it aggregate plan. The mid plan is called an embedded plan. And the high option is called an aggregate plan. I want to explain the differences here. This only pertains to employees who are enrolling family coverage. If you're enrolling a single, this does not apply to you because I've already explained the single benefits and how they work. If you're enrolling your dependents on a high deductible health plan, there is a difference between these plans. An aggregate plan is where your family deductible must be met first before the coinsurance kicks in. So if you're enrolling your family plan into the low plan, you have to satisfy your $5,000 family deductible. If you're the only one in your family that's hitting the expense of $2,500 with an aggregate plan, again, it moves to a $5,000 family plan if you have dependent coverage. An embedded plan is currently what you have now, and that's the mid option. What that means is that every member can satisfy the $2,800 deductible. Of course, it caps at $5,600. But let's say, for instance, you and your family members are on the mid plan. You're the only one satisfying your deductible on an embedded plan that's having services. Then once you hit $2,800, everything's picked up at 100%. On the low plan, if you have family coverage, if you're the only one that's having services rendered, you'd have to hit the $5,000 deductible before the carrier picks up at 80%. The third column with the high option also is an aggregate plan, so that too means if you enroll family coverage, you got to satisfy your $3,000 deductible and then your $6,000 out of pocket. Those are the main differences in these plans. Now, again, when you go to your network provider, if you go to a primary care physician on a high deductible health plan, you will probably pay a contracted office visit amount. It could be $50, $60, $75. I'm not sure what your primary care physician's contracted amount is, but it is a reduced amount because those providers agreed to be in the Blue Cross Blue Shield of Illinois network. So they agreed to accept certain charges. What you pay will go towards your deductible and also will apply to the out-of-pocket bucket. Same with prescription drugs. When you go to the pharmacy, you're going to pay a reduced amount. Whatever you pay for that drug will go towards your deductible, and it can, again, be used with your HSA debit card. The fourth option is a PPO option. This is very similar to the plan that you have today. With this option, it is an immediate copay plan. So if you were to go to a primary care physician, a specialty care physician, you pay your $30 or $50 copay. If you go to get a pharmacy drug, then of course you have a copay as well that will apply. It's immediate. The only time that your deductible will kick in is if you were to be hospitalized, have lab work, testing, and so forth. That would fall under your $2,500 deductible. Now, looking at all of them across the board, if you rarely go to the doctor and you want to know what your total exposure could be, if you're having a really bad year, you're going to be out the most out of pocket if you enroll in the PPO plan. As you can see, that's a $5,500 out of pocket if you're enrolled in single coverage. So keep that in mind because if you enroll in a PPO plan, you rarely go to the doctor. Most likely, you're just throwing money out of the window. If you wanted to enroll in a high deductible health plan, you could be putting that money, investing it in your very own HSA bank account. And we'll review that in an upcoming slide. What I showed you on that screen was in-network benefits only. If you went to an out-of-network provider, you're going to have a separate and higher deductible, separate and higher out-of-pocket. You're going to have lesser coinsurance, which means that you're going to pay more, 50% coinsurance. And then, of course, those out-of-network providers can balance bill you. So try to make sure that your provider, your doctor, your hospital participates in the Blue Cross Blue Shield of Illinois network. These are the instructions as to how to find a provider based on which plan you enroll in. If you enroll in one of the 3 high deductible health plans, the network is listed on this grid. If you enroll in the PPO plan, the network on that drop-down box is listed there. So again, if you were to call one of these places to say, hey, do you accept Blue Cross Blue Shield of Illinois? Everybody's going to tell you yes. That doesn't mean that they're contracted with them. So we want to keep you paying the least amount of money, keep you from being balance billed, and this is how you do it. Just make sure that your provider participates in the network, and it's best for you to check. Going back to embedded and aggregate, as I discussed on the medical slide, embedded is when you have family coverage, each person has an individual deductible. Aggregate deductible is when you have family coverage, but the total family deductible has to be met. Prescription drugs, Preferred Pharmacy Network is included with Blue Cross Blue Shield of Illinois. When you fill a prescription for up to a 30-day supply of a covered prescription from a retail pharmacy that's in network, you may pay the lowest copay coinsurance amount. If you fill the prescription at a non-preferred pharmacy, then you may pay a higher copay or coinsurance. So it works just like the provider network does. You want to make sure that your pharmacies too are in network. And you can go to myprime.com to look for a preferred pharmacy. You can also get a 90-day supply of covered prescription drugs at the retail pharmacy price if they participate in the preferred pharmacy network. We posted an updated 2019 drug list, which will also tell you when your drugs are hitting a generic or a brand or a specialty tier. We always want to recommend that if you're getting a new drug prescribed, that you ask your doctor if there is a generic or a brand equivalent available. Anytime you can stay away from specialty drugs or the higher costing drugs, it's going to save you money. So refer to the drug formulary that we're going to have posted. Please note that your preventive care is covered at 100% in network on any of the high deductible health plans and the PPO plan, as long as the provider files the claim as preventative. If you go to the doctor and you have an immunization, a mammogram, a well-woman checkup, well-child checkup, cholesterol test, and you get billed for that, then when you obtain your explanation of benefit, it's going to show what the provider billed, what they're supposed to write off, what Blue Cross Blue Shield of Illinois pays, and what your responsibility is. If you have a responsibility, then most likely we need to look into that for you. So we reach out to our office at that time with your explanation of benefits. Most likely, in the claims that we do check, it comes from the provider offices billing it as a sickness. So we certainly want to assist you with that. PPO plan, remember on the fourth column there, that was your PPO plan. That's where you get immediate co-payments, and the co-payments will apply to your out-of-pocket. They don't apply towards your deductible, and you are not eligible for an HSA bank account if you enroll in a PPO plan. With a high deductible health plan, that's one of those three options. You must first meet your deductible. There are no co-pays that go on those plans. You are eligible for a health savings account. Now keep in mind that your dependent children are covered through age 26 regardless of their full-time studentship or marital status. Now, usage of the emergency room. There has been language in every plan document called Prudent Person Lay Law. We reviewed this last year, and we're still seeing it go on today more than ever. If you go to the emergency room for a non-emergent situation, carriers can deny claims. Then when that happens, you're left to appeal the claim within 45 days, and it's subject to Blue Cross Blue Shield of Illinois approving it or declining it, which if they decline it, you're responsible for that entire emergency room bill. We're going to discuss alternative ways for you to seek care if it's a non-emergent situation on the future slides. This slide indicates your pricing effective November the 1st. The top grid is for executive plans and the bottom grid is non-executive plans. Please note that a $50 per pay period surcharge will apply for tobacco usage. Legence Bank requires also a tobacco and nicotine declaration form. Please note that this form must be updated annually. Wellness, Well On Target will remain with Blue Cross Blue Shield of Illinois. It's still offered as it always has been. If you have used it in the past, it's a very user-friendly portal. You go to wellontarget.com and you can get tools that's going to help you reach and set your wellness goals. You can take a health assessment. There's self-directed courses, health trackers, and a lot of educational content. You earn rewards for healthy living. With the Blue Point rewards, you have a debit card that will allow you to earn rewards based on your activity, and then you can redeem those points at the online shopping mall. Sample of activities and sample of blue points that you can earn is listed on the grid. They now have a Well on Target mobile app. So this gives you very easy access to your wellness activities at all times. You can go online and you can go to the Apple Store, the Google Store, you can download the application, you can take your health assessment from there, view your blue points balance, and track your data. I'd like to remind everyone of the virtual visits that you have set up with Blue Cross Blue Shield of Illinois. This is often forgotten, and as I mentioned in the emergency room slide, if you're going to the emergency room simply because your provider's office is closed, the urgent care is closed, it's late at night, it's early in the morning, it's the weekend, you're just trying to get treated, this is the way to go if it's non-emergent. That will apply for colds, flus, ear problems, pink eye, sinus infections, allergies, things that can be treated by a doctor Skyping with you through your mobile device or your computer with your web. There's also behavioral health counseling for anxiety and depression. Now, as far as the medical applies, if you were to do a virtual visit, if you're enrolled on the PPO plan, you would either pay your primary care copay or your specialist copay, depending on what type of professional you're speaking with and how they're contracted with the network. If you're enrolled in one of the high deductible health plans, you pay $44 at the time of service. Now, if these providers cannot help you, they're not going to charge you. They're going to steer you to your doctor's office or maybe the local emergency room. But if they are able to assist, you'll pay them through your HSA bank account card or your debit card. I recently had this done. I picked up pink eye, and I was in my pajamas when I Skyped with my doctor. I picked what doctor I wanted to visit with. She held the phone up to my eye. She diagnosed it, and we were done within 15 minutes, and I had my prescription waiting for me at my pharmacy when I got there. So I know where I'm at. I cannot go to an urgent care. I cannot go to my primary care provider for a $44 charge. I too am on a high deductible health plan, so I want to watch my money. My $44 charge, if you are on the high deductible health plan, will go towards your deductible, but that's going to be the most affordable. Plus, it saves you time, and you're not in a sick room, a room full of other sick people. Now, we do want you to go ahead and connect if you've not already registered. My mobile app is already on my phone. All I have to do is hit a button, and I'm ready to start Skyping with a physician. Keep in mind that you have a 24/7 nurse line available to you as well. Nurses are a wealth of resources. The difference with nurses, this service, is that there's no fee for this service. They can certainly give you advice, steer you to the right physician. If you're on vacation, maybe give you some alternate methods to keep you comfortable until your doctor's office opens, but they cannot prescribe medication. So just keep in mind that if you do need to speak with a nurse, you have 24/7 access. Also, additional tools with the Blue Cross Blue Shield of Illinois web portal is you can go and you can view your claims, you can pull explanation of benefits, you can do your provider finder. There's also a cost estimator tool that's really good. Say, for instance, you have an upcoming MRI that you're going to have done. Well, either way, that MRI, if you're enrolled in the high deductible health plan or the PPO plan, it's going to be subject to that deductible. So it's going to tell you what providers is going to give you that service for the lowest cost, and it just makes you better consumers of your health plan. In addition, we have another mobile app that I want to tell you about that you can download from the App Store or the Google Play Store, and it will allow you on your phone to find a doctor, get an ID card, view your claims, and a lot of additional information. So it's another easy access tool in addition to text messaging. You can sign up for text messaging, and what I really like about this is not only are they giving you fitness and exercise tips, but they're giving you prescription reminders. It may send you a reminder to check your blood sugar or to take your medication at a certain time. You even get claim status notifications, so you'll get a text message when your claim is processed. And how easy is that? That's very real-time access. What I do want to talk to you about too is GoodRx. Now, GoodRx is not related to Blue Cross Blue Shield of Illinois. This is a free app. We brought this about last year. We discussed this in our open enrollment last year, and I just want to put it back in front of you because, again, you want to watch your money if you're enrolled in any of the medical plans, and prescription drugs, they're just high. So what you can do is when you go to goodrx.com, you can put in the name of your drug, the dosage, and it's going to tell you once you put in your zip code where you can get that drug filled for the cheapest amount of money. The example I've given everyone with my pink eye, the doctor sent me in a prescription, so I get to the pharmacy and the vial is less than an inch in length, very, very small, and it was $150. Well, I'm on a high deductible health plan. I didn't want to pay $150, so I pull out my GoodRx card because when you enroll, they'll mail you a GoodRx card. When I first looked at that card, it was stating that I would owe $60, and after I went online at goodrx.com, I could even get it cheaper for $40, $45. So what I learned during my own process is that even though you get a card in the mail, I would recommend that you show the pharmacy what you pull up, the coupon or the discounted amount that you pull up on the website at that moment, because those cards are just like provider directories. They're outdated as soon as they're printed. So keep this in mind, especially if you're in the high deductible health plan. Now, when I'm on my high deductible health plan and I paid that $45, that didn't go towards my deductible. That basically was something that I chose to do because it's GoodRx. They were giving me the lesser benefit, and I knew I rarely go to the doctor. There's no way I'm going to come up with my $3,000 deductible with that $150 medication. So again, you just become better consumers, I think, when you have these type of tools available to you. The health savings account, as we discussed in a previous slide, it's available to anyone that's enrolled in a high deductible health plan. You cannot be enrolled in the PPO plan. With an HSA bank account, they're owned by you, the individual. The HSA funds, they will roll over and accumulate year after year if not spent. They have the ability to earn tax-free interest, and you can use them for qualified medical expenses such as your deductibles, co-insurance, prescription drugs, dental and vision care, long-term care, nursing home, and much more at any time without a federal tax liability. Keep in mind that if you make a contribution to your HSA bank account, Legence Bank will match your HSA bank contribution up to $200 per year. Who is eligible for an HSA account? Any individual that's covered by a high deductible health plan. You cannot be covered by other health insurance, including a medical flexible spending account, an HRA, or a PPO. So if you have spouse coverage as well, and you're enrolled on your husband's PPO plan, that makes you ineligible for an HSA bank account. You cannot be enrolled in Medicare, TRICARE. You cannot be claimed as a dependent on someone else's tax returns. Now, the example I'd like to use is many of you enrolled in the high deductible health plan last year. So you're on the high deductible health plan today. And let's say, for instance, you have an HSA bank account and you got money in that account, but 11/1, you want to transition to a PPO plan again. That money in your HSA bank account is still yours. You can still spend it on qualified medical expenses, vision expenses, dental expenses. But effective 11/1, because you're no longer enrolled in a high deductible health plan, you can no longer make a financial contribution into your HSA bank account. So that's how it works. You get to make a financial contribution into your HSA bank account as long as you're enrolled in a high deductible health plan. Now, keep in mind with a high deductible health plan HSA bank account as well, the money's put onto your card as it is payroll deducted. It's not advanced. These are the IRS contribution limits for 2019, 2020. It basically, what we see in the marketplace, it increases about $50 for single coverage every year. So there's a slight increase, and you still have the $1,000 age 55 and older catch-up rule. All of this is managed through WageWorks. Your WageWorks card will look just like this. It doesn't have a chip, but you swipe it just like your debit card. You can use your HSA funds to pay for some things that are just not even covered by the medical plan, such as fertility treatment, acupuncture. You also have additional you can use it for your contact lenses. You can use it for your dental appointments. You can pay your deductibles. You can pay, copays as you go in. There's many, many things that you can use it for. What you cannot use it for is unqualified expenses. So if you try to use that wage card, you try to go somewhere and you try to swipe it for an unqualified expense, it's not going to accept it. It's just a smart card like that. Now, I know when I go to my vision provider, WageWorks will immediately send me an email stating we need a copy of your receipt. My vision provider already knows that, so they printed out an itemized bill. And what I do is I have always uploaded it to the WageWorks site. However, there's a new application out with WageWorks, and it's called an Easy Receipts app. So you can make it easy on yourself. You can snap and submit photos of your receipts so that you can have them verified immediately. You'll know what your account balance is. So basically, you're simplifying the process. Again, you can download this from the Apple Store or the Google Play Store. Dental insurance. We made a change to the dental plan effective 11/1 this year. The plan is moving back to Guardian. There's only one plan that's going to be offered, but there's a dual option, and I'm going to go through this with you. Dental option 1 is called a value plan. We need for you to go to guardiananytime.com and search for a dental provider. You'll enter your zip code, and if that provider appears in the dental network, then you would want to enroll in the value plan number 1. If your provider that you've been going to for 20 years and you don't want to go to any other provider is not showing as an in-network provider, then you'll want to enroll in the NAP plan, which is option 2. The option 2 plan matches your current plan right now. The option 1 is a little bit richer. Now, when you're comparing the two plans, they both have a $50 single deductible, $150 family deductible. They both have annual maximums of $1,000. They both offer 100% payouts on cleanings, oral exams, sealants, anything that's diagnosed as preventative. But then the difference comes in under basic and major. The value plan under basic offers you 100% payout instead of an 80% as the NAP does, as your current plan does. So the basics would be fillings and simple extractions, anything that fell under the basic services. And then the majors on the value plan, the major services such as dentures, single crowns, that's paid at 60% versus 50%. So it's a little bit richer benefits. Both of these offer adult and child orthodontia. It will be covered at 50% up to $1,000 lifetime max. Note that that is a lifetime max. It does not reset annually as your annual maximum does. Now, the difference in the two is that the value plan, again, is in-network providers. If you have an in-network, out-of-network provider, it's just not appearing, you want to go to option 2, because what happens is that these providers are reimbursed at the 90th percentile, meaning that there's very minimal balance billing. The carrier is paying almost all of that bill for you. So that's why we've set up two options. So when you go to enroll, you should have a box that states, I want to enroll in value plan or I want to enroll in the NAP plan. Now, there are takeover benefits for orthodontia. If you are currently an orthodontia benefit for you or your child, Guardian will pick up where the current plan leaves off effective 11/1. Now, note that that same lifetime maximum is going to be dipped into. It's not going to restart. If you had your orthodontia done when you were with Guardian previously, they most likely will pull that up and show that you've already exhausted that benefit if it was exhausted at the time, because it's tied to your Social Security number. If you've never used this benefit before, this is something that you foresee using in the future, then you have a $1,000 per insured lifetime maximum. Now note, if you're already on the dental plan, you're going to enroll in the Guardian plan, you have no waiting periods. But if you're new to the dental plan, you're enrolling for the first time, there is a 12-month waiting period for major services such as dentures, single crowns, endodontics, complex surgeries, or orthodontia. So keep that in mind. You do have a 12-month wait for anyone not insured on the current plan now. Again, go to Guardian anytime, search for a provider, and dependent children are also covered through age 26. This is the pricing schedule effective November the 1st. The vision plan will remain through Blue Cross Blue Shield of Illinois. You've recently received a letter, most likely, that states that Dearborn Vision Plan was recently branded as a Blue Cross and Blue Shield of Illinois Vision Care Plan. The insurance policy itself remains unchanged. Your benefits and provider list will remain the same as well. But you will receive a new ID card with an updated website and customer service phone number, and it will have the Blue Cross Blue Shield of Illinois logo. Note that you do not need an ID card for either your dental or your vision benefits to obtain services with any in-network provider. A lot of us have more of a comfort feeling in taking in an ID card because years ago we had to have one. Now you do have to have one on the medical, but the vision and dental, once you give them your carrier name, they will pull you up by your Social Security number. Some of my employees, they feel more comfortable in taking a picture with their cell phone, so that they know if they leave that card at home that they got it somewhere. So wherever your comfort level is, just free advice there. What you can do is you can look at dearbornnational.com for your vision provider. Again, make sure it's a network. We've listed out-of-network reimbursements here. As you can see, it's not very much. So try to stay away from going to an out-of-network provider so that you get your money's worth. With this plan, if you're new to the plan, you have an eye exam every 12 months. You get new lenses every 12 months. You get a new pair of frames every 24 months. It will cost you a $10 copay for your exam with dilation, and then also additional copays for standard lenses as listed on the chart. You do have a $130 allowance for frames and lenses with additional percentage off the balance of either frames or lenses. Now, the way this benefit works is if you wear both contacts and you wear both eyeglasses, you get one lens allowance. So whether you choose to use that lens allowance in your eyeglass frames or with contacts, that's up to you. But note that you get a new pair of frames every 24 months. So if your eye prescription is constantly changing, you might just keep the frames and replace those lenses. This plan too have dependent children covered through age 26, as well as your medical and your dental plan. This is the pricing effective November the 1st. Legence Bank provides full-time employees with employer-paid group life and accidental death insurance through Dearborn National. The benefit is paid at 100% by Legence Bank, and accelerated death benefits also included. In the middle of the chart, you can see the group term life benefit based on your class status. You also have an age reduction schedule, so once you hit age 65 or you turn age 70, there is a benefit reduction built in. This plan also includes an accelerated death benefit. So if you're diagnosed with a terminal illness with less than 24 months life expectancy, you may be eligible for an advancement of 50% of your term life benefit. I hope this never happens, but it does happen. And just know that if you wanted to get some of your affairs in order, this may be available to you. In addition to the employer-paid life, you're also eligible for voluntary term life. Voluntary term life is through Unum. If you're a new hire under the age of 70, you can get up to the guarantee issue amount of $150,000 without health questions. You can go as high as 5 times your annual earnings or $5,000 if you do want to answer health questions if it exceeds $150,000. If you're a new hire, your spouse is also eligible to 100% of your amount or $50,000 without health questions. Anything above $50,000 will require health questions. And dependent children can be covered as well. Live birth to age 6 months is a $1,000 payout, and 6 months to age 26 is a $10,000 payout. Simple pricing is listed in this chart. There is a benefit reduction that starts at age 70 on the voluntary term life, and it too includes an accelerated death benefit. This is the special enrollment notice for 2019. So again, I went through as a new hire. If you're a new hire, you might elect voluntary life up to the GI or guarantee issue limit regardless of your health. Anything above will require a questionnaire similar to what I pasted on this PowerPoint presentation. We send that to the carrier, and the carrier either will decline or issue coverage based on your current health. Now, what we've negotiated is that employees and spouses who currently are enrolled in the Unum Voluntary Term Life Benefit At this one-time open enrollment, you and your eligible spouse may increase your voluntary term life benefit up to the guarantee issue limit without health questions. So what that means to you is employees under the age of 70 can increase to $150,000. Spouses under age 70 can go up to $50,000, again, with no health questions. If you want more than that, that's perfectly fine. You complete an E of I form. But why this is so important is none of us know what the future holds. So what you enrolled for in last open enrollment, you may have been diagnosed with certain conditions that would keep you uninsurable in the marketplace today. So this may be an advantage to someone out there who needs more life insurance. If you decide to not elect voluntary life insurance during this open enrollment, you'll be able to apply for coverage at the next annual open enrollment. However, it could be subject to health questions and review by underwriters. Keep in mind that you have travel resource services available through Dearborn National. We all, when we travel, we are excited to get on the road. We take care of all of the fares that we can think of, but situations do happen. Travel Resource Services is available to you worry-free. They have a toll-free number. They will help you with emergency travel arrangements, emergency cash, if you lost stolen items, if you need legal assistance, interpretation, translation, and obviously one of the important ones that I brought up previously or even last year was return of mortal remains. We've had some employees to go on vacation and be involved in accidents, whereas they passed away, and then their families left wondering how they're going to pay to get the remains back to the home state. This too covers that. So it's very important services. It's services that you don't have to pay for. Just know that you've got these available to you. Also available are beneficiary resource services. So if you were to have a loved one to pass away, then they're going to provide you with assistance with legal questions, funeral planning, counseling to cope with grief and financial uncertainties. And it's all available to you at no cost at this toll-free number. Now, if you go online, the information is listed as beneficiaryresource.com, but you will have to use the password Dearborn National. All this is confidential. Legence Bank does not receive any type of reporting. They do not know who's calling for services. It's just available to you through Dearborn National. As a full-time employee of Legence Bank, you're eligible to apply for voluntary short-term disability through UNUM. Now, short-term disability pays you an income when you cannot work due to a covered off-the-job accident or sickness that includes maternity. The voluntary short-term disability benefit offers you day one coverage for accidents and day A sickness payout for sicknesses and maternity. So the reason we put this in place is that the employer paid short-term disability starts after 30 days. You would have a 30-day gap without any pay if you didn't have the voluntary short-term disability in place. Now again, the benefits for accidents, the payouts start day 1, day 8 for sickness or maternity. If you're already enrolled in this benefit, you have no pre-existing condition language to worry about. If you are new to this policy, you're enrolling for the first time as a new hire, or you're enrolling effective 11/1, you will have a 312 pre-existing condition language built in. And what that means is if you're currently taking medications for anything that triggers a disability within the first 12 months, then there will be a 12-month waiting period for that particular condition. If you're currently pregnant, then there's also a 12-month waiting period. So it's a 3-month look back, 3 months prior to your effective date, and then it's a 12-month exclusion for that one. But let's say, for instance, you're taking heart medication, but something totally different caused you to go on a short-term disability, then pre-existing will not apply. Legence Bank provides all full-time eligible employees with employer-paid short-term disability. Now, this is the benefit that I said started on day 31. So every one of these are designed to leave you without any gaps of coverage. This one, again, is employer-paid. If you don't put the voluntary in place, you have a 30-day without pay before this one kicks in. So you have to be off at least 30 days before the employer-paid short-term disability will have a payout. The maximum benefit period is 9 weeks, and of course, all of that is dictated by the doctor's notes as to when you can return to work and when you cannot. Now, at this one-time open enrollment in 2019, we've negotiated with Unum to allow you to enroll in this benefit regardless of your health. This is not normal. If you're already enrolled, you have no changes that you need to make. But if you didn't enroll last year and now this is of interest to you, the voluntary short-term disability, you may enroll again without health questions next year. If you were to decline it this year, next year, there will be evidence of health and questionnaires that will be required. The short-term disability piggybacks with the long-term disability. So Legence Bank provides all full-time employees with employer-paid long-term disability insurance. It too pays you an income when you cannot work due to a covered off-the-job accident or sickness after the short-term disability expires. Again, this is paid in full by the company, so there's no cost to you. Again, the long-term disability policy will start in after 90 days. Your monthly benefits or payout percentages is listed in this column. If you're new to the plan with an effective date of 11/1 or after, you have a one-time 312 pre-existing condition language built in as you would the voluntary short-term disability. This benefit duration is to age 65 with reducing benefit duration as you are older. So if you're already, what that means, reducing in RBD is what it's called. If you're already 63, then it will give you a graded scale. You may have 2 years left of a payout. If you're age 30, it will cover you to age 65. So it's a very, very rich long-term disability policy. With Unum 2, you also have employee assistance program available to you that you can speak to counselors without paying any money for stress, depression, anxiety, relationship issues, family problems, anger, grief, loss, and you also have work-life specialists to assist you with credit report issues, medical, dental bills, identity theft. That's just one of our big marketplace concerns now is identity theft. So all available to you at no cost at a toll-free number. So again, this is all confidential. Legence Bank will not receive any type of reporting from the EAP. Accident coverage is offered to you through Guardian. Guardian pays you money for any off-the-job accidents. These are the same benefits that we've had in place before. You have two options. You have a value plan and a premier plan. The premier plan is a little bit richer. When I put the overview on the screen, this is just a very, very brief overview. There's a lot more payouts that's in the true policy, and we've got those policies posted. This is the pricing per payroll deduction. So accidents happen, whether you want to insure yourself, your child, or your whole family, there are payouts. You can insure your dependent children through age 26. I know when my children were driving, this is something once they turned 16 I thought I needed. So this is something for you to definitely consider. And as well as the cancer policy, we've not made any changes to the Guardian cancer policy. It pays you money upon the diagnosis of an internal cancer and as you incur treatment. Cancer happens. There are 3 different options you can choose from. Option 3 being the richest. As you can see by the pricing grid there, option 1 is going to be the most affordable. With the cancer plan, if you're already enrolled, your enrollment will stay the way it is unless you want to add a dependent or make changes. Dependent children are covered through age 26. You can also cover your spouses with this plan. There is one question you'll have to answer if you're enrolling for the first time, and I'll cover that on a future slide. Critical illness, we have good news for you on this policy. We have a policy in place that will work with the ADP enrollment now. So what we've done is we've opened up this benefit to you with a special 2019 open enrollment caveat. And what that means to you is that you as an employee may apply for a $5,000, $10,000, $15,000, $20,000, $25,000 lump sum benefit without health questions at the 2019 open enrollment. You can also apply for your spouse. They can get 50% of your benefit, and then your dependent child can get 25% of your benefit as well without health questions. And the reason I'm stressing this is because normally a critical illness benefit, if you miss taking it out during your new hire event, it's going to be subject to health questions. And whether or not it's issued will be up to that underwriter. What I like about this policy, it also includes cancer. So if you have a family history of cancer and let's say you're already enrolled in the Guardian cancer policy, but you take out a critical illness, let's say for $25,000. If on the diagnosis of an invasive cancer, you get a $25,000 payout from the critical illness policy, and depending on which policy you've enrolled in on the cancer policy, you could have an initial diagnosis payout, but you certainly will have payout for chemo, radiation, and any type of treatment on that policy as well. As we all know, the medical plan is going to pay most of your bills when you go to that in-network provider. But what if you're going to a provider that's not in-network? What if you had to go to a certain place to be treated for this, and it's causing you gas money, it's causing you to miss work, and so forth? So all of these unexpected expenses is what a critical illness policy is designed for, is to help you to cover out-of-pocket costs. So it also includes payouts for heart attack, stroke, organ failure, kidney failure, ALS, coma, loss of sight, hearing, speech, Parkinson's disease, severe burns, and there's even a 50% payout for Alzheimer's and 30% for Addison's, Huntington's disease, and multiple sclerosis. So lots of payouts. There's also second occurrence payout on some of these benefits as well. The pricing is listed at the bottom corner, so very, very affordable. As we get to the next screen, this is the open enrollment concessions. Again, as a new hire with an effective date after 11/1 or at this open enrollment only, it's a one-time event that you can enroll in a 5, 10, 15, 20, 25, whatever you want to do without health questions, and your spouse can get 50% of that benefit. The cancer benefit, if you have previously waived the cancer or declined the cancer benefit, you want to enroll this year, you may apply for it. There's one question, and that's if you've not been treated for or diagnosed as having cancer of any form, AIDS, or ARC in the last 5 years, if you can check no to that, you will be issued the coverage. If you have, then you may not enroll at this time. Accident coverage is very easy and simplified. There's never health questions, but know that it's not going to cover accidents until after your effective date, which is going to be November the 1st. There's no pre-existing conditions that will be covered prior to 11/1. As a reminder, this is your annual open enrollment. You must keep all elected benefits in place until 2020's annual open enrollment unless you experience a qualifying life event. And again, with the qualifying life event, you have 30 days from the event date to get your benefit changes to HR. This is a copy of your SBC. This came out with Obamacare, ACA. It's a 6 or 8 page document basically that tells you what is covered on your medical plan. It's kind of confusing to read, but it will explain what portion is your single deductible, what portion is your family deductible, what your out-of-pocket, and so forth. All of these are going to be posted on the portal. That concludes the 2019 open enrollment for Legence Bank. I'd like to open up for questions, please. You can either ask your questions or you can type them in on the chat bar.